Hour, we told you about the North Ottawa Community Health System's plan to remodel their emergency room and how they treat patients who frequently go to the ER when they don't need to. Spectrum Health already has a program that addresses this group. The Center for Integrative Medicine launched first back in 2011.
24-hour News 8's Danny Carlson first told us about it then, and today she sat down with the same doctor to find out how it's going. Danny?
You know, and we took a look at it today in reference to the announcement that North Ottawa made. Dr. R. Corey Waller with Spectrum Health says that he applauds North Ottawa's proposed revamp, saying that he thinks every hospital will have to have a similar program within the next 10 years that treats those people who go to the ER who don't need to, especially if they want to keep costs down.
Over time, if we reduce the misuse and overuse of the ER, our local population's health can improve.
Health improvements and cost improvements. Those are the goals of the North Ottawa Community Health System's emergency room remodel, expanding the building and the services offered. Another West Michigan resource.
I think that it shows that we're really ahead of the curve, nationally.
When Dr. R. Corey Waller and Spectrum Health first opened the Center for Integrative Medicine in 2011, a project similar to North Ottawa's proposal, it was the first of its kind in the state, focusing on patients who went to emergency rooms 10 or more times a year, both helping them and helping to cut costs.
It's not about getting them better diabetes care, it's about giving them the care all around. And those are the common things that we found, is not focusing so much on the disease, but focusing really on the patient and redefining the medical problem as anything that affects their wellness.
Those about 5% of patients make up about 60% of costs, Waller says. Many of the ER frequent flyers do have substance abuse problems. And there might be people out there who say, well, these people are just junkies, they just want drugs. Why are we devoting more services to these people?
Well, the interesting thing is there's a large amount of research and science that now shows that if we appropriately treat these patients, and we have great science behind the treatments now, that they actually become less expensive and more productive. They have to survive. And so in their brain, they're doing what they have to survive. And it doesn't always connect with the philosophy of what I am doing right, or is what I am doing necessary? It is, what do I have to do to survive?
Now, another consideration for addressing the emergency room concerns now is with more people getting insurance as a result of the Affordable Care Act, the number of patients expected to go to hospital emergency rooms is expected to continue to increase. Live in studio control tonight, Danny Carlson, 24-hour News 8.